Hey there, it's Dr. Jim. Thank you for stopping back for another coronavirus update. This is an extension of a video I did not too long ago. This is Coronavirus, the basics, part 2. People have been asked what they're most concerned about pertaining to the COVID-19 outbreak. The most common answer is that their family, particularly younger children and older adults, will become infected. Another answer deals with the fear that they may not be able to work and being unable to make or save money or losing money in the stock market. Surprisingly, or maybe not, the third most common response was concern over their own health and well-being. It seems that a lot of people out there are putting others before themselves. They're putting the needs of their family, friends, and others over their own well-being, over their finances, and other needs. So there's some good things coming out of this terrible, terrible time. But we still have to protect ourselves. So how people can protect themselves. Every expert on viral outbreaks and in medicine and healthcare say that washing your hands, at least for 20 seconds at a time, is the most important thing people can do to stop the spread of infection. Besides social distancing, hand washing. Wash them at home, work, before you eat, after touching any surface. And if there's not a sink nearby, carry and use hand sanitizer that is 60% alcohol or greater. Experts also remind us not to touch our nose, mouth, eyes, or our face in general, which seems pretty difficult to do. These are the gateways for germs and viruses to actually enter into the human body. Now, there's a difference between stocking up and hoarding. And I'm sure if you are watching television or you're online, you see these videos of people fighting over toilet paper and filling their, shopping carts up with everything that they could possibly get. While it is smart to stock up on food, water, and other supplies, it's not necessary to panic shop or hoard as much hand sanitizer and toilet paper as you could possibly fit in your car. There is a very strong emotional reaction that takes place in some people when they see others panicking and hoarding, and it starts a chain reaction. Purchasing shelf-stable foods like canned fruit and vegetables, pasta and rice is smart. Making sure you have enough ibuprofen, aspirin, commonly used over-the-counter remedies, and prescription medications is also very important. And of course, get your cleaning and disinfecting products and keep those well stocked and frequently used, by the way, in your home. So hoarding takes much needed products away from your friends, your family, your neighbors, and it deprives the elderly who maybe don't get out and shop as much as we do. Coronavirus is awfully tricky. One of the major differences between this virus and others is that an individual can be asymptomatic, which means showing no signs, no early signs, no moderate, mild symptoms, and they can still be very contagious. And that's why it's recommended for this self-quarantining and social distancing, hand washing and sanitizing for a couple weeks. And let's see what happens. Although self-isolation can be kind of rough, but it seems like it's working so far. Anything could change. If you develop signs or symptoms, if you've traveled from a country that has a massive viral outbreak or been exposed to people who you suspect were ill, and now you're experiencing fever, cough, shortness of breath, call your healthcare provider, tell them about your symptoms. Listen to the healthcare team. They're going to give you instructions on what you need to do to get to the clinic or the hospital without infecting other people, especially the healthcare professional. Once you arrive at the care center, they might ask you to put on a face mask, a gown, gloves. It's okay. It's normal. You shouldn't be afraid. You can ask for a test. The healthcare team will most likely test you for the flu, the common cold, bacterial infections, as well as other respiratory illnesses besides COVID-19. This is an issue of ruling things out. What about self-isolation? If you are told by your healthcare provider to self-isolate, listen to them. You will most likely stay home or in an area of your home to avoid spreading the virus to family members or even your pets. Limit your contact with others in the house. Always cover your nose and your mouth with a tissue if you cough or sneeze. Throw it away. Don't place it out on a surface where other people can touch it. Try your best not to confine yourself just to one room. Move around as safely as possible without risking anyone else's health. Make sure rooms are well ventilated. Experts are saying crack a window so that there's good air ventilation and flow in the house. Don't share any personal items like towels, cups, dishes, eating utensils. Not smart. Wash and dry them after you use them. Keep all surfaces in the house, as well as the bathroom and kitchen areas, clean and sanitize. Very important. Do not go in public places where there are large groups of people. Stay at a 6, 7, 8, 9 foot distance if you do go out for food, medicine, gas, stuff like this. Better yet, if you can, ask a family member to go out, maybe just one person heading out into the grocery stores at a time. Order out food and things like that. Have the necessary items like medicines delivered to you. A lot of pharmacies are delivering everything free now. Have the delivery person leave your items outside the door to protect you and to protect them. Even pizza places now have contactless deliveries, contact-free deliveries. I did it the other day. It was really cool. Final thoughts. While this virus is making a lot of people sick and has killed many, there are things that you and I and everyone else can do to protect ourselves. Hand washing, not touching your face. Stocking up on necessary items, staying away from sick people, monitoring your own signs and symptoms can all help you and I and everyone around us to stay safe and healthy until this pandemic is over. I'm Dr. Jim. Thanks for spending time with me, and keep coming back because I'm researching more and I have a lot more to share with you. Take care.